Hello, my friends. Welcome back to Healing Together. I'm so glad you stopped by today. I have a special story for you, a current event. I want to share with you a little bit of the last couple of weeks that we have been going through. The surgery on my knee replacement, the recovery, some of the opportunities to share Jesus and to share my book, and for the way that God has worked in our lives over the last 6 weeks now as we've recovered from total knee replacement. While we're getting started here, why don't you reach up there and hit that subscribe button, hit that like button. We would really appreciate it. Hit the notifications bell. We would just love if you became a part of the Healing Together family. I want to begin with a little bit of history. I have been a truck driver since I turned 18. Now I'm 66 as we speak. And so that has been a lot of time sitting behind the wheel and pressing down on that gas pedal. And that's the foot, the knee that's bad is that right knee. And so I've been doing a lot of that. I've driven a lot of miles in my life. I have had several injuries to that leg. I fell off the back of a truck and into the snowbank. There was a concrete block under the snow that you couldn't see. Did some real damage to the lower part of that leg. Then years later, I was buried in a sewer ditch. We were putting in a sewer tap, and I was buried in that. And I believe I probably broke my leg that time. I was on unemployment, couldn't really take the time off of work. And so we've done a lot of damage to that right leg. And about 10 years, my doctor, Dan, he started telling me it was time to look at getting that knee replaced. Combination of insurance that was good, but of course insurance never really great, and the inconvenience of losing work. And as I know what I know now, I'm glad I never did do it while I was working, because it's going to take a while for it to completely heal. And as a truck driver, it would make it quite a bit of a challenge to try to get back into a semi. So when I retired from trucking in January 1st, actually, I signed up for unemployment and I got started, and then we began to look at having the knee done. And it was the doctors were very convinced, let's put it that way, that I would be a good candidate for total knee replacement. So I met with Dr. Loafman out of Niles, out of the Lakeland. I guess Spectrum owns Lakeland now, here in Niles. And I wanted to have it done local, kind of like shopping local. I had always heard, oh, go to this hospital or go to that hospital. And I thought, I'll just go to the guys that keep Niles running. And so I did, and we went, and he didn't take 2 seconds. He looked at the x-ray, he grabbed a hold of my upper leg, and he grabbed a hold of my ankle, and he rattled it around a little bit, my knee, and he said, see all this movement in here? He said, we're going to get rid of that for you. You're going to be a great patient. And I said, okay, let's get it done. And he said, okay. He said, now, you know it's going to hurt, right? He said, it hurts, but he said, in the end, you'll be very happy you did it. So with that, I came home from that first initial appointment. We had set the appointment for the surgery, I believe. And as we were there, maybe not, maybe we had just begun to talk about it, and they were going to set the appointment. And I had a pre-op appointment in St. Joseph. And so we started going back and forth, conversations, telephone calls, and I was amazed by the time I got to my pre-op appointment. Not only was the surgery scheduled, but all of the physical therapy was scheduled. The post-op appointment was scheduled, and everything was pretty well taken care of. So it was really pretty amazing. So we got to our pre-op appointment, and we sat down to talk with the nurse there, and she went through everything that I was going to have done. She talked about the pain. She talked about the pain management. She told me when to report, and so we left there feeling very confident that we were doing the right thing. And we got ready for a 6 o'clock appointment for surgery on the 24th, or I'm sorry, the 27th of July. On the 27th, we showed up and we got our room where we were going to be pre-oped and prepped for surgery. And the two wonderful nurses, Loretta and Grace, were my two nurses. They were both a little older. They weren't older than me, but they were probably pretty close to my age. Very nice ladies. And it's always funny, ironic, but it's always funny to me when I go in for any kind of lab work or testing or anything that takes getting blood or having an IV. So Grace gets assigned the task of putting an IV in my arm. Now, you have to understand, my arm does not look like a normal arm, and so they decided to put the IV right in this area. And Grace was not real sure, and I have an idea that Grace has been around long enough. She's put a lot of IVs in. And so they actually have a new for me anyway, device that they can run up and down your arm, and they can tell where the veins are. Well, she decided to do that, and because she had looked around, and then she decided to do that. Well, when they ran it up my arm, these places, these tight spots that are actually in between, this is a skin graft and this is a tight spot, those tight spots all showed up as a vein. So they really didn't have any help with that machine. And I got to tell you, that machine was straight out of Star Trek. It's a small handheld machine about the size of a hair dryer is what it looked like to me, battery operated, and it was really pretty impressive. So she said, well, I'm going to try in this one place. And I said, have at it. She said, does it hurt? And I said, it kind of depends on where it's at. I said, a lot of the places on my arm is numb. There's no nerve endings there. So let's just do it. I said, I can take the pain. Let's just see what happens. And, you know, Grace came through. There was only 2 pokes, and she had a viable IV that ran the whole 6 or 8 hours that I was in there, and she did an extremely, extremely good job. Thank you, Grace, for what you did there. Next task was to shave the area where my knee was, and she got her stuff all ready. She didn't look at my knee. She just got all of her stuff ready, and then she looked at my knee. And of course, I'm burned on my legs too, so there's no hair where my knee is. And so that was another kind of comical thing. And she kind of looked around for something to cut, and I would point to this hair or that hair because there's only 1 or 2. It was really quite funny, and you might think this is crazy, but it's just comical because nurses and doctors and so forth, we all do. We get used to a certain normality, and when it runs into counter normality, we don't quite know what to do. Let me back up just for a second and tell you about beforehand. I went in, and like I say, the doctor was in and out real quick originally because there really wasn't much to discuss, except for the fact that I had forgotten one question, and that was the dressing that went on the knee following, because my skin is extremely allergic to the Band-Aids. And so I called and I talked to a nurse by the name of Matt, and I said, here's my situation. And he said, okay, let me check with the doctor and I'll call you back. So he called me back and he said the doctor wants to put a dressing like we use on the other leg. Let's leave it on for 10 days and see how that works. And so we did. Everything was fine, and I've never had any trouble with those dressings. They've had 3 now. So it's been very good, very good. They really took care of everything that came up. So we got in, the doctor came in, the anesthesiologist came in, and I have to say the art of anesthesiology has been amazing over the years. The anesthesiologist came in and he said, I'm going to put some blocks on the nerves of your leg so it will block the pain of your knee for a couple days. And he said, you'll know when it comes out because it'll begin to hurt. But he said for a day or two, it's going to help you with the immediate pain of the surgery. And so he came in and I was pretty well out of it. They had put something in my IV and really relaxed me. And Debbie was telling me later he went through and put in 6 or 8 places. He would just put some shots in. And I have to tell you, that pain blocker was amazing, because it was about 36 or 40 hours later when it started to go away. I began to realize they had done a major job to my knee. And I asked the doctor later, I said, what in the world size ball bat did you take to my knee? And he laughed. He said, well, it was a big one. And so I had over the couple of weeks that we waited to actually have surgery done, I'd actually watched the surgery, so I knew a little bit of what was going on. And what they did was they took my knee apart. They cut it, made a small incision, cut it open, and then they moved the patella, the kneecap, and they went in there and they sliced off the top of the tibia and the bottom of the femur. They have a pattern that they set on there where they can tell where to make what cuts. They put angles to it and drill holes and put the knee in, glue it all in. They put painkiller. They fill the whole thing up with painkiller and then put the knee together. Now, I'm sorry for some of you if that grosses you out, but it's really amazing because God says in His Word in Jeremiah, He says, I knew you before I knit you together in your mother's womb. After the surgery, I was talking to the physician's assistant, and I was telling him, I'm getting all kinds of noise out of my knee. It's cracking and popping and snapping. I said, it's worse off than the first one. I said, what is that noise from? And he said there is a cord of ligaments that run down through there. And he said, we don't cut across them, we split them, and then we kind of unravel them like you would unravel a rope. And he said what you're hearing is that rope being re-raveled, re-knit together. So God has actually made us so that they can unravel that, repair a knee that would cripple me in the next 5 years, and then through the Lord, it can heal itself and put itself back together. And I have to tell you, it is just amazing. I'm always amazed because of what I've been through. The skin is the largest organ of our body, and yet it can be burned away, it can be cleaned away, and you can take it from someplace else and lay it out. And now I understand, out of 1 inch of skin, we're talking burns now, not the knee, but out of 1 square inch of skin, they can cover 21 inches of burned area, and it within a week or two will grow and cover that open area to keep it from getting infection. That blows my mind. I'm amazed, and I'm not even a doctor. I don't even understand it. So anyway, we had the knee replaced. They opened it up. They did all the stuff they did, and I'm going to put in here the x-ray from the original one, and then the x-ray from the new one. I'm going to show you the knee that they put in, because it's just amazing to me how they put all that together. Now again, that was July 27th. When I got out of surgery, it was half an hour, 45 minutes. I began to come out of the anesthesia, and Debbie started talking to me, and I was just barely starting to get my head straightened out, and I was still laying in the bed that they had moved me back and forth on. And a young man came in, and he introduced himself, looked at my tag, asked me what day it was, my name, so forth. And he said, "Well, you ready to go for a walk?" And I looked at him and I said, "If that's what's next, let's go for a walk." He said, "How's your knee feel?" I said, "Like it's big as a watermelon." And he laughed. He said, "Yeah." He said, "Any pain?" I said, "Yeah, a little bit, but not bad." He said, "Okay." He said, let's go for a walk, and we'll see if we can get you kicked out of here." Now, my friends, we got there at 6 o'clock. I got into surgery about 7:30 or 8, and it was about 2, and they were already had me up and walking. So he got me up. I got a walker from there in the hospital, and I began to walk. And he looked at me. He said, "You're doing great." He said, you are a trooper." And I say that humbly because I didn't feel like it. I felt like a 185-year-old man with a bum knee. And I said, "Well," I said, "it's just about getting through it." And he walked me down the hallway. We stopped in at the restroom. We came back, and he said, "Are there any steps for your house?" And I said, "Yes, we live in a modular." And I said, "We do have 4 steps." He said, "Oh, okay." He said, "Come on over here and let's try these steps." And Debbie kind of rolled her eyes or something, and I thought, "Try steps?" And he said, "Let's try these steps." So we went up and down the steps, and he stopped me at the bottom. He said, "Now, Tim, I want you to know that when this pain blocker is off, when it wears out, you are not going to be doing this as well." He said, "So you're kind of going to go backwards, and then you're going to go forward from there." And so we did that. Well, I got back, and they had tricked me. They had taken away the bed, and they had put in a chair. So there was no more sleeping. And they put me in a chair, and he wasn't gone very long. We got to talk. I got to share that I was a Christian. He was a Christian. And he asked what I did. I told him I was an author and a YouTube content creator, and told him a little bit about this channel. And he said, "I'm going to have to get your book." And so I don't know if he has or not. I haven't seen him since at the physical therapy. So he was really a nice gentleman. I wish I knew what his name was so I could give him credit, because he was excellent. So Debbie and I were in the room for just a little while longer, and another young lady came in, And she said, I'm the occupational therapist. And I've always waited for this opportunity. And I said, well, you don't need to do any therapy because I'm not looking for work. So I don't need an occupation. And she says, well, you'll want to take care of yourself at home. So that's part of my job. So she went through a few things to do with the wound and with the surgery site and with my legs and so forth. And she went through quite a bit of that stuff. She was very nice again. And then it wasn't too long. We were signing papers and we were on our way. And they took us down. We got in the car. Debbie took me home. We shuffled into the house and we got ourselves parked and figured out how I was going to sleep and so forth. And really, I slept for a day or two, but then I pretty well went to work. It was only I think it was from Wednesday to Monday, and I started physical therapy. I haven't even went back to the doctor yet, and I had my first physical therapy. And they brought me in, and I thought I was going to die the first time when they told me what I was going to have to do. And so we went through leg raises and knee bends and so forth. And oh my goodness, people, when they said it was going to hurt, it hurt. It hurt, and it hurt some more. And thank you, Jesus, for some really good pain medicine. And I did not ever have to take 4 in a day, which was what was prescribed. I did take 3 in a day, but it hurt to start with. But I went to the doctor on that next Wednesday, so it had been a week, and the doctor took off the bandage, and I saw that I had 37 little stitches in there, or little staples in my knee, and I began to worry about how those little things were coming out, and it was pretty concerning for the next 2 weeks. And then I went 2 weeks, and they took them out. And I have to say, Matt is the son of Merva and Jim, and Merva and Jim are our friends, and Matt is too. But I hadn't met, I don't think, Matt yet, and he was fantastic. He took those staples out. I never even felt any of them except one that was in a place where the skin was real thin on the bottom of my knee. And it was fantastic. He just did a super job. So we have been doing therapy. We had 7 weeks, I believe, of therapy, or 6 or 7 weeks of therapy twice a week. I am down to 2 more therapy sessions. I have one next Wednesday, and I have one next Friday. And I can't not tell you how wonderful the therapists are. Erica has been pretty well running the schedule, has been running my work, and she has done wonderful. Chrissy also has been a part of it. I've seen Erica most, but Chrissy I've seen a couple times. Really connected with both of them. They are wonderful girls. Everybody's young compared to me, but they have just really taken care of me, given me good advice, kept me working, and kept me working at home. I do my exercises. I don't enjoy them necessarily, but I know they're what it takes to get through. I am now almost to the end. I have a doctor's appointment at the end of September, and then I have I'm hoping the doctor will release me to go to work. I have a job interview next week on Thursday. If you think of me, you can pray about that. And so I do have an interview. I'm hoping he'll release me. It's a ministerial job, so it shouldn't be real taxing. It should be really pretty simple. It's really up my alley, what I love to do. Networking with people, taking care of elderly people, doing Bible studies, leading worship, that type of stuff. I'm not a worship leader, but I can muddle through some old country gospel songs. So we just we're really looking forward to that. We are doing great. I have just started going up the steps with both legs. In other words, I'm not taking one step up, so forth. I'm just walking up the steps. I do real good with that. Very little pain. A little bit more pain going down. I'm still working on that, but overall, we are doing very, very well. If the doctor is encouraging you to do it, and I have to say, I talked to many people that have had knee replacement, and most of the time they would say it really hurts, but it will be really good in the end. And they would encourage me that way. When you get down the road 2 to 6 months, you'll be so happy you did. I'm already happy I did it. And I did run into one dear sweet friend just 3 or 4 days before the surgery. And they said, oh my gosh, you're going to hurt so bad. It's going to be so terrible. And I hurt forever. I hurt for 2 years, and on and on and on. I saw that person again on Sunday when I was at church, and they turned around and looked at me. I'm not using a cane anymore. I'm just walking normal. And they said, oh my goodness, you're a miracle. I can't believe that you're walking and not even using a cane. So very good for me. I probably am one of the ones that it was a little easier for. So I want to say at the end of this video, and this is going to be about the end of it for me, thank you so much for everyone who prayed for me. Thank you. I so appreciate it. You really saved the day, and you made a huge difference. Thank you. Thank you. Thank you. Have a great holiday weekend. It's Labor Day, and enjoy it. I so hope you do. We'll be back on Tuesday. We're going to talk about an incident in the burn unit that almost ended my life. As close as you want to come with this incident, we're going to share that and the victory in it. If you are in Niles and you're hearing this, I will be preaching at Summit on Sunday. We will be sharing a sermon. We've titled it Scarred for Life. And in other words, our life comes out of the scars. But I want to share something with you that is extremely dear to my heart about the scars that we carry. So please come and hear what God has for us. I know you won't be disappointed. Not me, but God. So stop by if you can. We would appreciate it. Well, the videos went longer than I expected. Hit that like button if you would. We look forward to seeing you Sunday. Our services are at 9 and 10:45, and I promise you I will preach long. You will get your money's worth. And you know that's not true. But anyway, actually it probably is. But anyway, we will see you on Sunday, or we will see you on Tuesday. Thank you so much for stopping by. I love you, my friend. Thank you for praying for me. God bless.